I would like to welcome back Jessica Curtis, who will be presenting the National Mental Health Engagement Mechanism proposal. And I'll also like to introduce our panel, who will share their thoughts today on the proposal. On the panel, we have Nicola Byrne, CEO of Shine. Nicola is registered social worker and an experienced leader, and she has worked in both the statutory and voluntary sections for more than 25 years. So welcome, Nicola. And next to Nicola, we have Patrick Bergin, who is the head of service of the National Forensics Mental Health Services and is the former director of the Oberstown Children's Detention Sector. So, Children's Detention Center, sorry, I don't know. You know, in those moments, you just get tongue-tied in the wrong time. And beside Patrick, we have Charlie Meehan. Charlie is the head of the mental health services in the west of Ireland, and Charlie has a keen interest in engagement and supports a number of innovative projects. So, firstly, welcome back, Jessica.
Thank you, Pamela. This time I found the clicker, which was under my paper the last time. I apologise for that. Okay, so just to briefly introduce this topic. This is an idea that has come from the National Steering Group. So we're looking at loads of different engagement mechanisms, loads of different ways to engage with people. And one of the things we mentioned earlier on is that engagement can't be valued unless it's measured. So we are suggesting that maybe this conference could actually be an engagement mechanism in itself every year. So, clicker in use. What we're looking at is an accountable process where the National Mental Health Operations Office, so that kind of higher echelon that was referred to, I think, by Tricia earlier on, that there's an accountable piece that's very specific to engagement held by that office, if they're up for it. Our proposal is that the office, or a designated group from that office, would agree to work on 2 issues that are selected by service users, family members and carers every year. And that the following year, that they come back and they report to the conference on their progress. The key to this is that service users, family members and carers are listened to, and that mental health services actually action the themes and issues that are agreed to. And I have highlighted here to a degree that it's feasible. And I've highlighted that for a reason. We have to be real to a certain extent, and transparency is super important. So we have to be realistic insofar as some things might take 5 years to happen and some things might take 1 year to happen. However, if the national team agrees to act on something, what we need to do is be a bit realistic. Like, for example, 1 year would be a really short amount of time for a national team to address the service reconfiguration issue. But we would expect that if the group agrees to work on that they'd come back the next year maybe with a feasibility study and some consultation work done with the people that it affects. But then again, 1 year, if this is something that was agreed to, and these are just examples, 1 year is enough time to introduce, say, a feedback mechanism in inpatient settings and to demonstrate a couple of outcomes from that feedback mechanism. Does that make sense to people so far? Okay, great. So this is what it looks like. And this, again, is a proposal, and it's an early stage proposal. So let's just see what we think of this. So the idea would be that forums and public engagement events happen around the country. They're led by engagement leads and other people who'd be interested in working with them, maybe from recovery functions and so on. They're led by that group, and issues that people feel are of national importance are discussed at those regional forums or public engagement meetings. All of the highest level ideas are then sent to the office that Michael is the head of and that I'm currently working in, the Mental Health Engagement Recovery Office. Then we discover which are the 5 most popular or most important, highest level issues that have come up, and we present them to the national team then at the next conference, and they agree maybe to work on 2 of these and come back and report on them the following year. Does that make sense in that circularity? And then the idea is that that cycle would happen every year. We're talking about this cycle starting next year. And is there anything else important I wanted to mention? I think this is basically just the stepped order of that model that I've just shown you. And just a reminder that the cycle would start every year, and the idea for this proposal is to begin it next year. So that means that those regional forums and regional public engagement pieces would happen in 2023, early in 2023, and then by the time the conference comes around, we're able to present 5 options for the national team to choose 2 to work on. Okay. I really wanted to make an important note that this idea wouldn't replace any existing local engagement activity that works really well. It just adds a national dimension to the work, and it can be measured, so it supports the accountability and makes that engagement mechanism a formal mechanism. Okay, that's all I have to say, and I'm going to hand back over to Pamela, and I'll just leave this up for you. I think it would be helpful.
Yes,
Yeah.
Thanks for that, Jessica. So I'll look over to our panel here. Nicola, could I ask you to briefly share your thoughts on this proposal?
I think that anything that presents an opportunity for improvement and change is good. I think, though, it's that old saying, with rights you have responsibilities. I've worked in the HSE for a long time, and most recently I left it nearly a year ago. And I think often there's lots of great change goes on. So first of all, we need to look at ways of recording change and improvement, because that memory gets lost along the way. The other risk, I think, is that people need to feel that they're listened to, and that they see a report on what's being delivered, that we complete the loop. The problem with big organisations is staff turnover, and that we need to have a complete follow through. I know I've been around a long time in mental health services, and I've been involved in lots of different, you can call it whatever you want, the latest, there's lots of, I trained in project management, and I see an awful lot of the project management buzzwords that we use today. But at the end of the day, you're talking about families, you're talking about people who are unwell, who are trying to access services, and they might not ever be able to access it until they're in a crisis. What I'd like to see is us finding out more about the people who can't get access as well as those that access. I often meet the same people at events. So my concern is that we're consulting from a small group over and over again, and that we don't get the diversity. You know, in Shine, we were lucky enough to win the bid to host the reference group for the National Implementation Monitoring Group for Sharing the Vision. And every time we talk about it internally, we go, is it representative enough? I don't think it is. We went out and we recruited, we got people back, but probably those that heard about it are already active in mental health services and active in engagement.
I will also say within that I really resonate with that. Being from the Black community, being from somebody who lived in direct provision at the time, that's a community that never really has access to these services. So that is so important to look overall at who you want your service user to be, and see how we can get these services to them. And I think that's
really important, that we don't keep drilling into the same well, that we find new ways and innovative ways to meet new people, to get new ideas and new insights.
Okay, thanks, Nicola. So, Patrick, can I also know about your thoughts on this?
Yeah, I suppose I was looking at the proposal, and I suppose I just comment on the framework that's been suggested around engagement. There's a couple of, I suppose, observations. 2 topics at the end of a year, how they're going to be identified is going to be challenging. I think, going back to the point we just made in relation to drawing from the same pool, I think there are lots of issues that people would like to see progressed that need to be identified, and they will be anyway. So I think that there are some areas of improvement, as they're identified, will become part of other processes. So I think you go back to the forums and the public engagement, there might be quite a lot of issues that are identified. So if we could capture those and look at whether they're year 1, year 2, and year 3, because they may be tied to sharing the vision or other developments, and they can't be lost. It would be very hard for, after consultation through regions and throughout the country, to narrow it down to 2 particular issues. So I think that's a challenge. I think the other issue around having, I suppose I'm going back to the 2, and I'm just considering some of the challenges I experienced over the years. It is about looking at, some may take longer to evolve, to close off or get resolution. So I think there would be a challenge around a work plan in relation to maybe a number of different issues rather than just 2. And I think that might help people understand and continue to engage, because I don't think you can go, year one, we've done this, year two, we've done this. I think it's an evolving piece, and it's over a period of time. I suppose just in the context of a lot of points that were raised this morning around engagement, I think the whole issue around the regional and the partnership approach that has to be taken in this is key. And while we're looking at the whole concept of engaging with service users, there's also a real challenge around, for people like me that are in the service, how you develop that, how do you actually deal with competing demands, and that is a real challenge. And I suppose what came to life for me was, I suppose, work that I had been involved in previously around engagement and understanding, how do you protect those that are involved in that engagement process, whether that's service users or whether that's HSE employees, whether that's families, whoever that is. And there's that level of protection around being able to share your thoughts, share your views, understand the different challenges that exist so you can get to a solution or a resolution. The other, I suppose, 2 points that came to mind was about preparing for this. So I suppose I was mindful, and I think it was Tricia, she was the only one that mentioned, not that it's not happening, the concept of researching on how you engage with service users. And the understanding which is we don't have to, there are lessons that are learned nationally and internationally that would help us to maximize the potential of how you engage and how you draw out very quickly the core issues. And that, for me, was important. And the last piece is around provision of service. So while this is going on, the expectation is from everybody involved in the process that services will still continue, that the care needs, the challenges that experience are resolved. So within that engagement consultation process, there is a real need to ensure that you can manage the different competing expectations that people will have within that process.
Yeah, no, that's super important, and it actually brings me back to my days in the lab and all the KPIs, our key performance indicators. We do really have to measure our improvement services to see, is there really an improvement? So yes, absolutely. And now, Charlie, what would be your thoughts?
I think the key to it is, I think the word was used a few times, meaningful engagement, and how we meaningfully engage with people who use the services in order to kind of develop a whole new way of delivering services. And part, I think, of the framework we're talking about here, I think it was Trish again who touched on the word meaningful alignment, is how we actually kind of bridge that gap between those who kind of manage services and those who use our services. And I think it has, and I think what we have demonstrated here today, and particularly from a national point of view, I think there is a commitment to do so. I think at a regional level, we as management teams need to also demonstrate that commitment and have kind of really meaningful engagement with the system in order to change the way we deliver services. I think the work Clara and Cathal have done is a real example of that. I think it's about really trying to get that consultation in a meaningful way. It was about going in to acute units, and again, as Clara said, it was even her stepping back to allow Cathal, who had the lived experience, who the service users were much more comfortable dealing with. I think it's trying out new ways of actually engagement. And ultimately, I think, that kind of partnership approach worked very well, but I think that the real challenge and the real key is how we then, from a service point of view, makes that meaningful and can deliver on that. Like, there's a number of very, in terms of the survey we did in Roscommon, for example, there's a number of very challenging issues around a lack of capacity, and there's a number of ways of looking at that, but it could take 5 to 10 years to be able to deliver that in its entirety. So I think we need to be realistic. However, there was a lot of issues that actually raised within the survey that we could deliver in the here and now if the commitment is there to do it. It was expanding our family services. Again, we were able to kind of respond to that. There was lots of other things we were able to do in the short term. So I think the key to, even for the learning from our survey, is how we're going to actually make that meaningful and how we're actually going to be able to deliver on that. I think the same here. I think in terms of, and I hear the 1 year coming back and picking two issues and coming back, in a year's time and then maybe being accountable for it. I think we need to be realistic about what we can achieve, because I think if real change is going to be sustainable, I think we have to build on it year to year. So again, I think the approach we're taking within our service is we're going to take the survey that we have from Roscommon, we're going to go out and meet our staff, and we're going to say, look, this is what we're hearing. How can we make this better? How can we collectively address these 8 issues that have been identified? And then that goes into a strategic plan in terms of year 1, year 2, year 3. But then I think the whole issue, which I like about the whole structure that's been talked here, is that there has to be accountability as well. So again, the kind of building in the kind of key performance indicators, building in the accountability structures around it. I think also the problem sometimes is there could be really good innovation going on in one area, even where I work, and then in another area it's not happening. So how do we consistently then implement these really kind of meaningful engagement with service users, and then even looking across the country, how we replicate it. So we have a whole systems approach. So I think, organisation commitment is very important. I think leadership is very important, and I'm talking about leadership at every level. I think it's national, regional, and also too with the development of a service user leads in that, it's the leadership they'll be able to provide and really reflecting the views of service users on the ground. So I suppose, just to summarise, I think it is all about kind of meaningful engagement, but it's creating the structures then that we can actually deliver that. And I very much welcome the proposal here in that regard.
Yeah, and I think that is so important. Even here now with everyone, your thoughts, your opinions, they matter to our service. I think that real change only comes from when people actually stand up and call for something. So be sure to make sure you're giving your thoughts and your opinions on today as well, so that we can be able to improve even this conference going forward.